femoral compression hemostasis device is used to assist hemostasis of the femoral artery after transradial procedure. Femoral compression hemostasis device, electric type. Pull out the starting bar, the power indicator lights start flickering. Switch the locking switch to unlock. Toggle the pressure adjusting switch to observe whether the movement of the compression plate is normal. Mark the position of the artery pulse of dorsalis pedis. Place the guard plate and bypass the thigh, and install it firmly on the back of the puncture site. Pull out the sheath a little from the puncture site. Observe the puncture site carefully. Make sure there is no hematoma. Remove the paper film on the stabilizer. Make sure the compression plate is placed directly above the puncture site. Fastening the bands around patient's thigh respectively. The bands should be firmly placed between the thighs. The main body of the hemostasis device is preferably above the thigh. Lift the compression plate 1.5 cm 2 cm can test bandage tightness. Press the compression plate to stop bleeding by left hand, while pull out the sheath slowly by right hand. The right hand pushes pressure adjusting switch to strong, and the left hand keeps the pressure until the device has produced enough proper pressure. Turn back 0 to maintain pressure. Check if the puncture site completely stops bleeding and the artery pulse of dorsalis pedis is normal. If the bleeding is stopped, but the patient feels too much pressure, adjustable switch to weak for a suitable pressure. Then switch back to 0. Once again, check the condition of the blood site and the artery pulse of dorsalis pedis. Confirm that the patient is in good condition. After the compression begins, observe 10 minutes and eliminate bleeding from the puncture. Then lock the switch to prevent misoperation. And maintain the pressure at this time. Maintain the duration of the hemostatic compression, usually lasting 2 to 6 hours. Do not rush to remove the hemostat after the end of the pressure. Continue 1 to 2 hours of low pressure to stop bleeding and reduce the occurrence of emergency. Remove the hemostatic device. Clean the puncture site with disinfectant. Check the puncture site. Then stick a hemostatic plaster.